Hi, my name is Claudine D. Aguirre from M2A section. So today I will be performing the bed patting including the shampooing, oral care, and back massage. So first is I will review my client's chart. This is for any limitations in physical activity that may cause any injury or discomfort. And then I will also bring the necessary equipment to conserve time and energy. And then after that, I will also perform my hand hygiene to prevent the spread of microorganisms, and then as well as my PPE for proper precaution. And then I will also put on my gloves for the safety and avoid contamination. Okay, so after that, I will now identify my client. Hello, sir. I'm Claudine Aguirre, your student nurse. Can I please know your name?
Marzutoshi Dida Nasato.
Your birthday?
April 28, 2007.
Your age?
19 po.
So today, sir, is I will be giving you a bed patting including shampooing, oral care, and back massage. Is that okay?
Yes po.
Okay, so first now is I will now close the curtains as well to provide privacy. Okay, assume that I close the curtains, so I will now adjust the height of the bed to a comfortable position to prevent an injury and back strain. And then after that, I will now rinse the towel and wash his face. So first, I will be doing his eyes first, using inner to outer. Okay, please close your eyes. Then on the other side. Okay, then after that, I will also be cleaning his face from the forehead down to his cheeks and chin. Then after that, I will again rinse the cloth and also clean his neck and as well as his ears. So first over his neck and then to the other side of the cloth on his ears. Then after that, I will also dry his whole face to avoid any irritation. As well as the neck and the ears. And then after that, I'm going to wash his upper extremities and lower extremities. So first is I will provide this towel. This is to avoid wetting the bed. And then now I will put on the towel over his arms. Okay, after that, assume that I'm going to have this towel with the soap and then put it on his arms again. And then as well as don't forget to also use this towel in between his fingers and the palm. And then after that, I will again rinse the arm. This is to keep him clean as well from getting the soap all over his arm. And then after that, I will now dry his arm using this towel. Then after that, on his lower extremities. So, sir, is it okay if I unfold this?
Yes.
And then, again, I will also put this dry towel under his legs. To prevent, again, from getting the bed from getting wet. And then, after that, I will again rinse this cloth. And put it on his lower leg. Okay, after that is the I will put again a soap over his legs as well. And then after that, rinse it again. And then after cleaning his lower leg, we will again dump this dry cloth to prevent any irritation and coldness from the skin. Okay, sir, I will now remove the dry cloth. And then after that, I will also clean my patient's abdomen and chest. So I will rinse again this one. So to prevent from getting his cloth or the blanket from getting wet, so I will use this dry cloth once again over his chest, as well as to still prevent privacy. Okay, now I will rinse his abdomen and as well as his chest. So sir, is it okay?
Yes po.
Okay, after that, I will also, if needed, so we can use again the soap with the towel with the soap and dry and put it all over his chest and abdomen. And then just make sure to keep his chest and abdomen with the clean water once again. And then dry all over the chest and the abdomen. Okay, sir. And then, so now I'm going to raise this side rail, assume it that I did, and then do the other side of the of his body. So now I will now be doing the shampooing care. So first is I will put a towel on his head, on his neck rather. This is to prevent from getting the bed from getting wet. Sir. So just assume that there is another new basin as well as this one to do his shampooing. So first is I will get the water and rinse his head. After I wet his head, so I will now of course do the shampooing and then put it all over his hair. And don't forget to massage as well to provide circulation. And then after that, I will now again wet his head. And then after that, we will now pat his hair all over to keep it dry. And if needed, you can also as well use a towel in front of his face to prevent any wet, to prevent any from wetting his face as well. And then I'm going to use another cloth to to dry his hair from getting wet. To dry his face from getting wet. And then after that, if needed, you can also comb his hair after that. Okay, sir. Thank you. So after that, I will now do the oral care. So is it okay if you go to a sitting position? And then I'm going to give him a small cloth to put it on his chest to prevent from wetting his his t-shirt. Okay, assume that this is a new basin where he will spit the water. Now I'm going to put this toothpaste all over the toothbrush. So I will brush his teeth from upper to the lower surfaces and as well in front and at the back. So please, sir, so first in front of the teeth and on the side. Then can you please say ah? So to the upper surfaces as well. And then on the below surfaces. And then can you please stick out your tongue as well to prevent any bad breath. Okay, so sir, can you please use this water? Okay, spit on the basin. Okay, so after that, you can also provide him some mouthwash if needed to prevent from getting the bacteria and as well as to have a good breath. Okay, you can now again lay down, sir. And I will just remove the cloth. And then after that, to the last one, which is the back massage. So I will roll over my patient to have the, in order for me to massage his back. So can you please, sir? 1, 2, 3. Okay. After that, I will be again using a dry towel underneath his back. This is to prevent getting the lotion on the bed and surfaces. And then after that, I will now use a cream and massage his back from the waist to the shoulder in a upper motion. You can do this for all over 4 to 5 minutes. This is as well as to provide circulation and as well as relaxation all over his system. And then after that, assume that 5 minutes is now done. I will also again use another cream to prevent any irritation and do a back massage in a circular motion again from his waist to the shoulder again. This time it is in circular motion. And again, just repeat the procedure for 4 to 5 minutes. And then after that, I will now dampen the excessive cream all over his back to prevent any irritation. And then I will now remove the towel. And then I will now position my patient once again. Okay, sir, do you feel any uncomfortable situation? Okay, well, so now we are now done doing the bed patting. So I will make sure to to put all the whole device if he needs any other assistance. And then I will also remove now my gloves to perform a hand hygiene. that's it. Thank you for cooperation.